Hello, let us now know how to do the surface marking of the lung. To do the surface marking of the lung, you need to show it in the form of four things like representing the apex of the lung is the first, representing the anterior border of the lung, number 2, representing the inferior border of the lung, number 3, and representing the posterior border of the lung, number 4. First, we'll start with the apex of the lung. The surface marking of the apex of the lung and cervical pleura are same, and the points to be considered are. On either sides, I am doing simultaneously. First point is locating the corresponding sternoclavicular joint. This is right-sided sternoclavicular joint. This is left-sided sternoclavicular joint. Second point is roughly measure the distance of the clavicle and divide it into 3 parts and mark a point at the junction of medial 1/3, so medial 1/3 and lateral 2/3 of the clavicle. Similarly on this side also. Roughly this is I need to measure it. This is second point. And third point is midway between the two. How much distance? Around 2.5 centimeters above, about 2.5 centimeters. So this is 2.5 centimeters is this. So in the middle of these two, 2.5 centimeters. So roughly like this. Okay, this is the third point. 2.5 centimeters above. Join these three with an upward convexity. Join 1 with 3 and then 3 with second point. Similarly 1 with 3 and 3 with 2 with an upward convexity. This represents the apex of the lung. Coming to the anterior border on the right side, right lung, first point is right sternoclavicular joint. Second point is middle of sternal angle. Third point is right xiphisternal joint. Or third point is middle of the fourth costal cartilage and fourth point is right xiphisternal joint. Join 1 with 2 with slight inclining towards medially and the remaining 3 points vertically straight. This represents the anterior border of the right lung. Coming to the anterior border of the left lung, first point is left sternoclavicular joint, same like that of right side. Second point is middle of sternal angle, same like that of right side. Third point is middle of midline at the level of the fourth costal cartilage, similar to that of the right side. Fourth point is around 3.5 centimeters to the left from the sternal margin across the fourth costal cartilage. So this is the fourth costal cartilage. Along its lower part, take a point which should be 3.5 centimeters to the left from the sternal margin. And the next point is around 4 centimeters from the midline along the sixth costal cartilage. From the midline, I am putting 4 centimeters and I am taking a point on the sixth costal cartilage. Join 1 with 2 with inclining towards medially. Second point with third point vertically straight. And then take a left turn to join with the fourth point and from there you join like this. So this represents the anterior border of left lung. Coming to the inferior border on both sides, mark a point along the mid-clavicular line at the level of the sixth costal cartilage like this. Similarly, mark a point at the level of mid-clavicular line at the level of sixth costal cartilage here. Similarly, mark a point at the level of eighth rib in the mid-axillary line, this one. Mark a point at the level of eighth rib in the mid-axillary line here. Join these two like this. Similarly on this side, and this represents the inferior border of the lung. To represent the posterior border, you need to take 2 points 2 centimeters away from C7 spine above and 2 centimeters away from T10 spine below. Join these two vertically that represents the posterior border of the lung. Okay. For the pleura, it is C7 and T12. For the lung, it is C7 and T10. That's all. This is all about the surface marking of the lung. Thank you.